Courtney Medical Group, located at 3075 Washington Road in McRae, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics. Of course, it's where we encourage you to call in to join in today. Well, in its truest sense, folks, it is a Friday. It is a get-em-up, out-of-town version of our show. Last time I checked, we were able to do this on November the 18th. Now, you may have a lot of things stored up, a lot of questions maybe you'd like to ask, a lot of guests in between. I've got some things I'd like to wrap up, sort of bring things together nice and neat. I'll be waiting for you to come on in and knock on the door, establish yourself, and find out what's on your mind. Whether that's in the form of a question or a comment, either is okay with me. The number to do that, as you should well know by now, 412-825-6262. That's 412-825-6262. Get them up, out-of-town version, open phone today. Also, too, a launching of a brand new program I'll be talking about before the hour's up. Now, in terms of the calendar, let's take a look. Hope you enjoyed Dr. Vavavoom herself on Wednesday. She made that topic worthwhile, did she not? The 20 different ways to avoid, reverse, prevent hangovers. Some of them were very, very interesting, were they not? Of course, we've come to know and expect Susan and her ability to do that. And she is already scheduled, just to let you know, folks. She'll be back once a month. She'll be back in January. She's going to be here on the 4th. She even inked her for our February show, which will be on the 1st of February. I have no idea which either of these shows are going to be pursuing and discussing, but of course I'll let you know as we move off into the future on it. Monday's guest, I want to talk to you special about Monday's guest. It really is in keeping with the launching of a new program around here. What else? Oh, MCG testing, of course, is underway, folks. We were out in Monroeville doing that testing on Monday. Yesterday, we were here in the office doing the same. Next testing dates for MCG out in Monroeville will be the 20th of the month. If you, maybe you're going to be out there Christmas shopping. Stop in. It'll only take you 15 minutes before we turn you around and get you back out there. So if you're heading on into town, if you're in the outlying communities and you don't make it into town too often, maybe you can combine the two and get the MCG testing done. Now, those of you who might not have heard of this before, and I admit it would be rare that you had not, but MCG testing is something we're quite proud to bring to you. This is a test entitled Multifunctional Cardiogram, MCG, and it is a unique way, an electronic way of assessing the status of your coronary arteries, and doing them in such a way that we can actually find out how much disease, how much plaque you have in those vessels without ever having anything invasive done to you. Certainly no catheterizations, which of course is the gold standard for detecting the disease and the amount of disease in the coronaries. Of course, there are other things too, ultrafast CT, that really never seem to make it as an old technology by now. There are some scannings out there that do a half effort on, I would say, the cardiolite scanning. Thallium scanning are those kinds of scans, but they really only detect the presence of disease once the disease is really out of control. MCG does not. It is able to tell us how much plaque you got going on now. It, in so doing, allows you to find out, once you've established that you understand the amount of plaque that's in the coronary vessels, it lets you put into play a program to do what you want to do, which is to reverse that plaque and to be able to check it objectively as you do so. Now, that's what I really find to be the beautiful thing about MCG testing, which we brought to you first in February, and now we continue to bring it each and every month, the MCG testing. The rest of this month will be the 20th out in Monroeville, and then I'll have the January dates for all of you. I'll say next week. I'll come in with the January dates for both locations, whether that is the Monroeville office or the McMurray office. Other things. Well, HCG testing also too is a very unique thing we do here. That is a hormone, of course, human chorionic gonadotropin. Big, long name, found. It's called the pregnancy hormone, folks, but it also should be called the cancer hormone. As it turns out, all cancers make small amounts, very minute amounts of HCG, which can be detected through sophisticated laboratory analysis done in only one lab that I know of. It's called American Metabolic Laboratories. Dr. Emil Schandl is the director of that lab. We've had him on the show. If you feel you would like to check on your status with respect to cancers, whether or not you've never had a cancer, or whether or not you think you're a cancer survivor, this is the sophisticated test that you want to take in order to confirm your suspicions or reject them. And I direct you to the show done on October 10th and October 12th. So hit to the archives and listen to the shows again. Dr. Emil Schandl was our guest on the 10th. I sort of took over on the 12th and did a rehash of what we learned on the 10th, and I believe those two shows will get you righted and on the right track, allowing you to make a decision as to whether or not you want to do HCG testing here in the office. So give us a call on that. What else? Let's take in the news, as we normally like to do on one of these shows. I've been collecting various articles over the last 2 or 3 weeks. One that caught my eye is one that appeared just in our local Trib Review. Of course, it emanates from a study done, and it deals with the 4 common drugs that often send seniors to hospitals. Now, drug overdoses and inappropriate drug use, inappropriate prescribing of drugs is a absolute large participant in causing and provoking things that require medical attention. They say an estimated over 100,000 older Americans are hospitalized for adverse drug reactions yearly, and most of those emergencies stem from 4 common medications, so says a new study. And with these medications in mind, 2 of them are diabetic medications. The others are coagulation oriented. Here they are. The top 4, the number 1 reason that people are seeking medical attention in emergency rooms for a drug overdose, number 1, doesn't surprise you, it's Coumadin, it's warfarin, it's rat poisoning, and it's a commonly used form of anticoagulant, especially in a condition of atrial fibrillation, prior implantation of devices like heart valves and such, which require very thinning of the blood is part of it. But this is something that is always has a potential for getting out of control, and certainly it does. They say 33% of those individuals admitted for some form of overdosing are in that category. Insulin is the number 2. Of course, it's used to control blood sugar in diabetics. It was involved in 14% of the cases that had to be resolved in an emergency room. Antiplatelet drugs. Now, this one catches me a little off guard. I didn't realize that so many, I know side effects are coming from any drug, but I didn't really know that the antiplatelet drugs, which are the big categories called platelet aggregation inhibitors. These are the slimers, folks. These are the ones that slime up the platelets. You know them, aspirin, Plavix, which are used to prevent blood clots, were involved in 13%, so It just is beat out by insulin, but only one. And finally, the last of the big four that end up being resolved in an emergency room setting because of drug overdosage are oral hypoglycemic agents that you take to, like Actos and the like, and that's in 11% of the cases. So, of all those admitted for drug overdosing, these four are the top, and as you can see, 33% of these emergency visits for overdosing occur in the Coumadin category alone. All right, let's do this. Take a short break. When we come back, I got a couple other items in the news, but I want to do some wrap-ups here. By the way, get a pen because you'll want to write down. I have the pearl. I think the Konstantin Monastersky pearl of dieting, and it just hit me when it was on the show. I said at the time, I had never heard that before. I haven't ever forgot it. I'll pass it on to you when we return with open phones. See you in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Well, sorry, I've got to go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shakes. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit's unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday version of the show. In its truest sense, it is a Get 'em Up Out of Town version of the show where we'd like you to call in and set the agenda. Anything on your mind is okay with me in the form of a question, yes, or a comment. I listen for your knock on the door, and when I hear you knocking, I let you right on in the store. And by the way, I just heard a knock, so why don't we go ahead and do that. Good morning. Hello. Welcome aboard. What's on your mind?
Hi, Dr. Courtney.
Hi.
I think it's like a gland or something just above my pubic region. I don't know. I do construction work and everything, and it involves a lot of shoveling, lifting, that sort of thing. And at the end of the day, it's just you almost need to get horizontal, and like a half an hour drive home is excruciating. And I'm pretty sure it's a gland, and it's almost like it's all bound up in like fiber and stuff like that.
Well, you're talking about the pubic area and in the pelvis, low midline, right dead center in the middle, huh?
No, just to the right hand side, just above the pubic region, about an inch or something.
Yeah, the central structures there. I mean, of course, prostate's a little further back, but there could be. How old are you, sir?
52.
52.
Like a lymph node or the gland or something like that.
Oh, well, hey, that's easy. I'll tell you what, you got to get this thing identified, and I want to tell you the best way to do it because they're very, very good with identifying pathological structures, and that is a sonogram, okay? I mean, this could be prostatic. This could be bladder, because that's certainly in the midline. Anything off to the right or the left, there really should not be a structure, a normal structure. It could be, like you mentioned, a node, a hot node. It could be, in fact, I had one recently diagnosed because I had I'm going to say a protuberance or something that I could palpate in my pelvic area. It turned out it's a dermoid cyst. Now, that's a pretty crazy kind of a cyst, but nonetheless, certainly caught me off guard to hear it was dermoid. But rather than leaving this in the realm of suspicion, a completely non-invasive way of detecting this is to have a sonogram. We do them here, by the way, routinely. All pelvic sonograms are done on all patients when we do workup. So if you're thinking about maybe getting the entire workup, why don't you come on in and see us here? Our cardiologist, Dr. Oliver Caminos, brings his whole staff twice a month. The next time they're in my office is actually going to be next Wednesday, and every other Wednesday thereafter. They've been doing it for only 9 years now. But I think that's the best way to isolate, and you'll be able to tell. If it's a lymph node, the sonographer will be able to tell that. If it's another cyst, the sonographer will be able to tell that. If it's
these sort of things surgically or what?
Well, depending on what it is. Now, my particular case of dermoid cyst is within the muscular wall itself. And so I'm going to watch it for a while, but of course the resolution of that's an abnormal structure, is I'll have to get that removed surgically at some point if it should become necessary. So I'm just going to keep tabs on it for now.
Hey, I remember a few months ago you were talking about the disparaging price differences in prescription drugs. You mentioned something that you could get for $18, and then Workman's Comp wanted you to sell it for...
Oh, you remember that show, don't you?
Oh, I've experienced this myself. I take, like, hydrocodone, like one a day or something.
Okay.
Right? And I found them for $12 a hundred, and CVS wants $53 a hundred, and every year or so I'll just call CVS and see how much they want for them. And I know a lot of people, like, on welfare and Medicaid and that sort of thing, and they're taking Percocets, and they're charging $225 for something that I can basically get for $12 to $15 a hundred.
You know, that all came from the fact I was sitting down. We were trying to put together a what do you call it, a Urgy Center, you know, and one of the elements we had to go through was, okay, what kind of meds are we going to stock here at this Urgy Center that we're thinking about putting together? And we had a group present to us one of the ways to do it, and they came in with a list of drugs, a whole bunch of drugs, from a whole bunch of different categories. But they said, if you pick these particular ones, okay, so if it was an antibiotic, maybe they said to pick this particular brand. If it was a narcotic, it was this particular brand. So you can order any old drug, but if you ordered these ones, the ones that we're telling you about, the markup on these is so great that you can make a lot of money, we can make a lot of money, and because the insurance pays a heck of a lot of money to reimburse for it. I thought it was so unique that somebody's actually owning up to the fact that we're getting gouged. I brought it to your attention. I brought it on the show, and you remembered that show. It's been a while since I did bring that one up, but I'll never forget it, and I guess you never will either.
Well, I even called Health and Human Services and demanded to know why they'll pay 10, 15 times, 5, 10 times more for a drug that it took me 3 phone calls to find it for $12 as opposed to $53. And I just asked him, why can't you find these things cheap? And then why are we as taxpayers required to give CVS that much of a markup? And their answer to me was, we have no idea how much money goes out. We only make sure that these people qualify for the benefits. And I was appalled.
Well, being appalled just dates back in my mind to the first time I became appalled with the price of these, which was how hospitals built. Like, if they gave you an aspirin in the hospital and you look at your bill, the aspirin was like $22.50, okay? And you would say, when you looked at your bill, why in the heck would my insurance company pay $22.50? Well, as it turns out, they didn't really pay $22.50. If you were a cash-paying patient, which, oh boy, if you want to talk about the biggest gouge of all, the person who needs the most help about paying a hospital bill is that individual that really doesn't have any insurances to cover those services. So you walk in, you'd think you'd want to extend to that person the most economical way of getting the bill paid. No. It works the other way. If you walk in without insurances, you are going to pay through the nose and other parts of your anatomy we can't even discuss here. And you're going to pay dearly, and here you are, the person that needs a bit of a break. You'll get no break because you have no insurance company out there fighting for you, and you're going to get top. You're going to pay the $22.50 for the aspirin, I guess, is the best way to put it. Why this works this way and how they can justify it, I guess it's above my pay grade. I don't understand it. But you get angry, I get angry, and the rest of our listeners do, with this completely crazy way that billing occurs when it comes to reimbursing for anything, let alone drugs that could be purchased in volume so cheaply, yet if you don't have insurances, if you're paying out of pocket, you're going to pay through the nose.
Well, if that committee that was supposed to do something about national debt wanted to do anything, they should start there. I mean, there's $100 billion a year right there.
Yeah, but sometimes, in one person's bill, you could easily tabulate up thousands of dollars just for one person. And so, yeah, in the grand scheme of things, across the country, it's phenomenal. Yeah, I think that you're doing well by contacting your insurer and letting them know your disgust.
I called all kind of people. They told me to call my congressman and everything. He didn't even know that. Nobody knows what you're talking about. They think you're from Pluto or something when you start discussing it.
Oh, he knows. Your congressman knows. It's just not in his.
Probably has stock in CVS.
Yeah, it's not in his best financial interest to.
Right, thanks, doctor.
Well, thank you very much for your call. I can tell a bit of a disgust on his voice. Hey, get it off your chest too. See, he needed to do that. We vented together, and maybe you have something that you want to bring to me and do the same. The number, of course, 412-825-6262 to do that. Waiting for a knock on the door. Now, I want to bring this to you. I felt, I can sit in this chair and bring a lot of guests to you, and I'm as attentive as you are as these guests come by because they truly do have powerful messages, but every so often a pearl pops out. A pearl that I go, oh my goodness gracious, I never thought of that way before. And so in the keeping of that kind of a thought process, I wanted to bring to you what I thought was a major pearl that came out of our show that we did on November 28th with the Mad Ruski, Konstantin Monastersky. Now, you know the guy's very knowledgeable. When he first came to our show, he was talking about two things we had never really discussed before. One was fiber, and now you're all educated on fiber. Fiber is a no-no. Fiber is a no-no, by the way, if you're actually taking fiber for fiber's sake. If it's in your diet, just as a part of your diet, without you trying to come up with some sort of number, how many grams of fiber, as long as you're not doing that, I think Konstantin is quite clear about, don't worry about the fiber. But he wrote a book on fiber. He educated us on fiber. He spent 3 days on the subject of constipation. Now, how can you spend 3 days on that subject? Well, Konstantin certainly did. But when he was here on the 28th of November, the topic we were working on was reversing your diabetes. And, of course, we are in an epidemic of type 2 kinds of diabetes, and where over-insulin production is the root pathological mechanism. And a person with type 2 diabetes becomes a diabetic not because he doesn't have any insulin, as is the case in type 1. In the type 2 diabetic, he's got insulin all right, but the moment he consumes any carbohydrate, the gush of insulin is so tremendous that the person builds up a resistance to that insulin, and then that is like he has no insulin at all. Go figure how that overabundance can produce such a medical dilemma. During our discussion on that day, Konstantin discussed 5. I said, give me 5 points, Konstantin. 5 different things that a diabetic would want to do in order to reverse diabetes. It turns out there were 5 things that probably any person who's thinking about weight loss at all should consider, But this was pearl number 2. And when he said it, the first time he said it, I really pondered it for a moment. But about 45 seconds later, I came back to it. We ended up talking many minutes about it, but I now bring the pearl back to you. I think it's the key. And now the second of his recommendations was place nothing sweet in the mouth for 3 to 6 months. Of course, he was talking about a diabetic, trying to get a diabetic returned around so that they aren't diabetic anymore. By the way, Konstantin Monastersky had done that on his very personal case of diabetes. He was a type 2 diabetic. He is no longer, and he was trying to give you an idea of how you could do the same. But this thing about putting nothing sweet in the mouth, I came back and I said, Konstantin, do you mean anything sweet? What about taking something that has sweeteners in it? Oh Lord, we got pink sweeteners, we got yellow sweeteners, of course we got the white sweetener, we got xylo, we have all these sweeteners, and we feel that if we're on a diet or if we're trying to curb our carbohydrate intake, that the best way for us to pull this off is to use a sugar substitute. And I got to tell you, I think I've been in that camp for the longest time. The point was, and I think it's the pearl of, for sure, the month, maybe the year, is that the secretion of insulin and over amounts of insulin is a hormonal response to placing something sweet in the mouth. And the body at that point can't distinguish whether you're putting, the deadly aspartame in there. That's the blue stuff, by the way. The pink stuff, which is saccharin. The yellow stuff, which is sucralose. It doesn't matter what color the envelope is. The fact that something sweet, get in the mouth, causes the hormonal response, the gushing of insulin from the pancreas, to be just as strong as though it was table sugar. Now, it is true that whenever the sucralose or the aspartame or the saccharin move into the bloodstream and have to ultimately be metabolized, they won't be metabolized as a carbohydrate. They won't carry with it the calorie count of a teaspoon of sugar, but that's the second whammy. The first whammy was the placing of something sweet in the mouth. There is an immediate hormonal response where the gushes of insulin that you're trying to prevent will spew forth exactly the same as though you put a tablespoonful of sugar in the mouth, which nobody does that anymore, do they? They avoid it like the plague. However, if you're taking a sugar substitute, that sweet-tasting substance provokes the hormonal response that kicks off the insulin rush that leads to the hyperinsulinemia, that leads to the further progression of the condition of type 2 diabetes and moves you forward. You using a sugar substitute cannot avoid that consequence. Yes, it will be metabolized in a few calories, will contain many calories, but that's the metabolic side. The hormonal side, I thought that was the pearl of the month, for sure, from Konstantin Monastersky. I had to bring it back to you. I think it's an absolute important pearl, and I'm glad to be able to pass it on to you again. Of course, he had some other things too. He said, well, again, 5 recommendations. One, he said, go buy any book on carbohydrates, is what he said to the diabetic. The number 2 one, place nothing sweet in the mouth. We just got done talking about that, for at least 3 to 6 months. He said, limit fiber. That was number 3. He said 4, stop drinking water. By the way, that was an interesting one too. Stop drinking water to excess. This is a problem. This causes water intoxication. This causes the dilution of electrolytes. It spins things you don't want to spin. And I think we're all under the impression that we should be drinking scads and scads of water to sort of flush everything out. This is not the case. And then finally, he said, raise your thermostatic mechanism, which I related to thyroid-related issues, but it's just rejecting cold in general because you need to increase your thermostat. You need the heater on in order to metabolize properly. Those were the 5, but I bring that nothing sweet in the mouth is the pearl and pass it on with my best regards. Now, hey, let's do this. Take another short break. In the interim, you may want to chime in on this. 412-825-6262 is the number to do that. That's 412-825-6262. When we return, we'll do a wrap-up of LDA. You know LDA. We've been talking about it for the last 3 shows. Be back in a moment.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. We're here in a Friday morning version of our show. It is a get 'em up out of town version of the show where we invite you to come on in and set the agenda around here. Anything on your mind is okay with me. Make that a question, make that a comment, just make that call, 412-825-6262. While you're waiting to dial us up, I've got additional things on my plate. One of the things I feel that I really need to do, we spent 3 shows in a row with my good friend and mentor, Dr. Roy Carey. You who have pursued and follow alternatives in the western Pennsylvania area couldn't have done so without at least the awareness of that gentleman. He is a brilliant beacon of knowledge, and he shares it with anyone who asks. He's absolutely shared with me and has become, as I have mentioned, a mentor to me in many different categories of therapies. This particular one, he's now mentored again and brought it to you folks, talking about allergies. As an ENT doctor, of course, ear, nose, and throat doctors, really, you can't conduct yourself as an ENT physician without knowing you're going to confront allergies of some type. And it's safe to say that Dr. Carey has had a lifelong quest for finding allergy treatments, whether they were conventional or non-conventional. It was whether they worked or not that truly was his guiding light. Now, he's one of the first to bring to you the Nembutalpod approaches, energy corrections. And then the offshoot of that was Biosets by Ellen Cutler. And he really developed that to a level of finality in his office. Complete staff devoted to allergy correction via Biosets, via the energy terrain, which he does not utilize anymore. Instead, he supplanted it. He's put in place of it a one step better, called LDA, low-dose antigen. I'll get to that in a moment. I'll get back with it. We do have a knock on the door. Let's come on in the store with you. What's on your mind? Go right ahead.
Good morning, Dr. Courtney.
Hi.
I had an insulin level check. It was 3. Is that good or bad?
Boy, that is awful low, isn't it? I don't know. I guess I'm surprised that that an insulin level would be 3. I don't think I've ever seen one that low. To the extent that there isn't really a concern with diabetes, as long as the fasting glucose and hemoglobin A1C say so, that would be my only concern with the insulin. And so, if you're not a diabetic, if you're not a closet diabetic,
I had this A1Cs at 6.5, 6.4.
oh, you are, absolutely. You are diabetic.
7 now, yeah.
You are diabetic.
Well, it's 5. A1C's 5.7 now. So.
Yeah. Okay. So anything over 5.7. Have you been diagnosed as being diabetic?
Not exactly.
Okay. Well then, at the moment, then you must have a normal fasting blood sugar, but an elevated hemoglobin A1C, which puts you in a category. I think I invented a word for you. It's called a closet diabetic. It means, as it stands right now, when you go to sleep at night, whatever your blood sugar level is, and you never take it, because who does at home unless you are diabetic, whatever your blood sugar level is, by the time morning rolls around, your homeostatic mechanisms bring your fasting blood sugar right in at normal, somewhere around 100, slightly below 100. But when we check these hemoglobin A1Cs, and as you say, yours is 6.4, is that what you said?
Yeah, well, the last test was 5.7, yeah.
Okay. Well, 5.7 is right at the border, right at the line, so maybe you're not the best example, but 5.7 is the cutoff, 5.7%, and this would mean anything that and above indicates that from the moment you start taking in food, your blood sugar is literally all over the board, only to be brought back into homeostatic control by the next morning. This evidently is a process that goes on for years until finally you lose your homeostatic control, and the morning fasting blood sugar finally is off the wall, and the doctor says, aha, you are diabetic. When in fact, it could have been known years beforehand, and someone could have interceded when it would have been so easy to turn it around. So I can't really comment on an insulin level of 3. I've never heard of such a thing. I think that may be a lab error, to be quite honest with you. Nonetheless, the 5.7 and below, hey, that's okay. It's a pretty good hemoglobin A1C. You're really not a closet diabetic. If you've changed your diet and taken it from 6.4 to 5.7, if I heard you correctly, you are to be commended and keep it in control. Watch your carbohydrate intake and you'll do fine.
Yeah, actually, most of it was just cinnamon with chromium in it.
Oh, hey, that thing with the cinnamon, a wise old buddy of mine who was full-blown diabetic, was taking those drugs, oral anti-hypoglycemic agents, and or the hypoglycemic agents, not anti, and he doesn't have to take them anymore, based on cinnamon tea and honey every morning for about 4 or 5 months. His blood sugar got so good that he didn't have to take anything at all, and even to this day does not need to take it. That's now 2 years in the making. So I could understand the chromium, especially in the form of chromium picolinate. I think that's a vanadium is another one of the minerals that is quite helpful in diabetes and is able to help reversing that particular problem. But that thing with the cinnamon, I think, is a neat little pearl that was passed on me by a non-medical person, but I'm glad to hear you're aware of it and it works for you.
Yeah, a quick comment. I'm surprised. There's an article in a paper a couple of days, well, maybe 2 weeks ago. It said the average cost of a cath is $20,000.
Oh, no, not a calf.
That's the article says. The average cost of a catheterization is $20,000.
Oh, my goodness gracious. You know what? Because of the charges for the hospital, for the room and the staff and so forth, you may be right. I'll tell you something interesting about the cath. The cardiologist that does the catheterizations, when that study first became available and was really hot, I'm going to say the 1980s was the hot era for cardiac catheterizations. It was just coming into its own light, and it was being paid, the cardiologist was paid about $2,500 to do that cath. Nowadays, now here it is many years later, 30 years later, the cardiologist gets paid about $350 to do the cath. So you're going to be upset to hear that the tab of $20,000 that the hospital makes is monumental compared to the $350 that he's making. In fact, I asked the question, why do you do, I say to my cardiology friends, why do you do caths? All that risk, all that potential harm, and you take that on for $350. What are you, crazy? And they actually look at me and they shake their heads sometimes and go, yeah, it seems awful crazy to me. But $20,000, I hadn't heard that number in a long time. If you say that it costs $20,000, it's got to be based all on hospital costs, not on the doctor.
No, but didn't break it down. I was just saying the average cost around here is $20,000.
Still an amazing number. This thing, hospitals, that's why they put the cath labs in, folks. They leave the electricity on 24 hours a day. They love their cath labs.
Yeah, I got a question. On my MCG test, I had a 3.5.
I remember you now, yes.
You said my blockage is around 30% overall. What would have been the numbers if I'd had a 2.5 or a 4.5?
Well, the MCG testing is a raw score number somewhere between 0 and 20. And as I think I told you directly, the highest ever scored on one of my patients since we've been doing these in February is 12. But it's not a linear 12. In other words, you would say, well, if 0 is great, then 3.5 is like wonderful. Well, no. 3.5 isn't wonderful. 3.5 indicates there's plaque there. It's probably minimal, 20, 30%, but nonetheless, the process is in play. And if left untouched, that will become 30 and 35%, which will become 40%, which will become 45%. As time moves on, the occlusion factor of the plaque will just continue to mount up. So I say to anybody, and in your case, by the way, if you don't mind, you were a patient who had bypass surgery, if you remember telling me, okay? Right. And that you actually have numbers that are showing that your grafts, I think you told me you had 3 bypass grafts done.
Yes.
And what that score indicates is that's your graft, wide open. You had your grafting done in April of 2010, if I remember correctly.
Correct, yes.
And these are still wide open. I asked you, and you did seem to know, that of your 3 grafts, one of them, by the way, comes from the internal mammary artery swung off the inside of the chest. The other 2 come from veins, usually in the leg. The 2 vein grafts are going to last 7 years before they're going to completely shut up again, unless you maintain them open. And the artery from the internal mammary contribution has a life expectancy of about 15 years before it loads up again. So right now, although other vessels in your body are corroded and clogged up, those coronary vessels are wide open because of the grafting. Now just keep an eye on this, because as time moves on, you want to make certain that you stay 3.5 and don't venture any higher, because if you did nothing, that's exactly what would happen.
Yeah, I was going to show this report to Dr. Gantz. I'm sure he may ask a question, what's 3.5 mean, because he won't do.
By the way, those of you who get this testing done, I'll be happy to give you a sheet that I'm given in order to interpret these. I know that many times, ladies and gentlemen, you take these results to your other doctor. You're really catching them off guard. They've never heard of MCG testing before. I know it's a shame that they haven't. But it is the newest thing out there, the newest thing on the block. They will be hearing about it. Might as well be hearing about it from you. And to take that sheet about what to do versus what the score says, I think is a nice little follow-up. I think I'm going to start doing that, by the way. Give patients the actual sheet of the scores and what they mean and what should be done about them to help your poor doctors understand what you're doing for yourself. Anyway, nice to hear your voice again.
Okay, so Dr. Gantz has to call you for an interpretation.
Or we just let you carry one of those things to the next time. He won't. Believe you me. Dr. Gantz, whoever he is.
Final comment, if I can, or actually to your listeners, about Go Away Gray. Mm-hmm. Has anybody ever out there heard of it, used it?
You mentioned it. You came in and told me that you had a product. that was sold in the health food stores, right?
Yeah,
Go ahead.
it's supposed to help.
Tell the listeners about what you found because I thought it was interesting. Go ahead.
Well, it's supposed to be a product that's called to help your hair come back to color. It's capsules, I guess, or tablets. I've not talked to anybody that's ever used it. I'm trying to find out if anybody's ever used it. How long does it take to get results? It's supposed to help your hair come back to color, get rid of your gray.
All right, you put it out there on our airways. If somebody out there has taken, what's it called? Get out your gray?
Go away gray.
Go away gray. Let us know for all of our benefits. Thank you very much for bringing it up. I'll see you in the near future. Okay, bye now. Yeah, good set of questions. I remember seeing the gentleman just last week, by the way, having completed MCG testing. Now, I want to mention a guest we're going to be having on Monday. And I just booked him yesterday, as a matter of fact. But he'll be the first in a string of guests that is going to be discussing what I believe to be a very important medical entity. One, I have a feeling, well, not a feeling only, but I know, is not getting any coverage at all, simply because I believe that the conventional medical community feels as though, well, there's nothing you can do about it. Now, the particular problem I'm talking about is a very wide and well-known problem in terms of how easily it's found in the general population, referred to as peripheral neuropathy. Peripheral neuropathy is a bear. It obviously is found when the microvasculature of the distal extremities, whether they be hands and feet, or legs or arms, loses a blood supply over time, and the various nerve fibers that are expected to provide you with information about the proprioception of the foot and the palm can't do it anymore. And the legs get, they could get numb, they could get tingly, there quite frankly could be pain that results from it. But this is a well-known problem in the diabetic community, and certainly now even found outside that diabetic community in some pretty high numbers. And up till now, I'd have to say that it's pretty much been a wash, that conventional medicine really has nothing to offer in the way of getting it turned around. I hope, by the way, starting on Monday, you begin to see that, in fact, this is now a conquerable problem, that this peripheral neuropathy and the associated symptoms that go along with it is a reversible condition, because there's a protocol, and we're going to be launching that protocol. And I'm bet you to say that the protocol we're going to be utilizing here is going to be a unique one of a kind in the entire country. We're going to start on Monday talking about peripheral neuropathy and what to do about it. Our guest on Monday is going to be Dr. Alan Jacobs. He's a podiatric physician in St. Louis, and he's written a paper describing the reversal of peripheral neuropathy. You've got to hear about it. We'll do as many shows as we can in the month of December. We're launching a program I'll be describing in great detail in the upcoming weeks on the reversal of peripheral neuropathy or peripheral vascular disease. Got another knock on the door. Come on in the store. Hello, and welcome aboard. What's on your mind?
Good morning, Dr. Courtney. I was on YouTube, and I saw there's this 13-part video on there from a doctor, I think it was Robert Beck.
Robert Beck.
Yes.
Okay.
And he has a thing called it's almost like it's a blood purifier. It's done with electricity.
Okay.
Heard of this?
Blood purification to the use of electricity. Right now, I'm got to claim I'm not getting any. No, I say I don't think I've heard about this. Do you want to describe it to us?
He said you could make it. This is, I think, the video, the initial video, and he's supposedly still alive, was 1984-86.
Okay.
And he said at that time you could make it for like $20-some from Radio Shack. He said something about a loop in your arm where closer to your wrist, your palm up, and you connect this to there, and these two electrodes. He said something about a loop, and your blood flows through there. That's why you put it there. And he said if you do that in the protocol that he says with taking colloidal silver and something else to help clean your lymph nodes and things out, this will actually cure quite a few things. He's talking about cancer, talks about curing HIV, and
well, here's what you can do for me. I'll go to the YouTube site if you tell me what the address is. Do you have a particular address at YouTube?
I think if you just go onto YouTube and put in Dr. Robert Beck, then all of a sudden a whole bunch of different things will come up about him.
All right, I'll go to it, and I'll let you know, okay? I'll just take a look. I'm not one, I mean, that's some outlandish claims, but I'm not one to quash anything until I've had a chance to take a look at it. I just got to tell you, up till now, at this very moment, I've not heard of Dr. Robert Beck. I'm not aware of this little loop he's talking about in the wrist, and but he's making some very big claims, and got to be careful here, but I think it warrants a look-see, and I'll do that.
Okay, because he does a full scientific explanation of how it works and why.
Oh, I would love to hear that scientific explanation. Okay, thank you very much, sir.
Thank you very much.
Okay. Dr. Robert Beck. You can go take a look at it, too. Let me know what you think. I'll let you know what I think. And I will go take a look at it this weekend. We got another knock on the door. Come on in the store. Hello, and welcome aboard. What's on your mind?
Hi, Dr. Courtney.
Hi.
I just wanted to give a comment to that man who was talking about the go-away gray.
Yes.
I remember a year ago on Channel 2, the local news, they did a little spotlight on that, and they had 3 or 4 people who were using it, and they did claim it worked.
They claimed it worked.
Yeah, there's something, basically, you can go to the supplement store and get the active ingredients yourself, but I know in homeopathy, you just take minute amounts of copper and, those trace minerals, and it'll counteract the gray pigment that comes out of your hair.
Well, there you go. So you're familiar with the product? I thought when you told me that KDK was involved, that we're going to hear like the Yvonne Zanos Does It Really Work thing?
Like that. It wasn't necessarily that segment, but it was something like it, yeah.
Mm-hmm. Well, and the end result was it actually did work.
That it did work, I think, for 3 out of the 4 people. It took a while, but it counteracted that.
There you go. The caller should
But there's
know.
one active ingredient in there, and I can't think of it right off the top of my head. But you can get it, like, just the active ingredient off the shelf at a health food store.
Well, we'll just check him there and then we'll explore it. Thank you so much for answering a question that I had no answer for.
Okay, bye-bye.
Okay, there you go. See, what I don't know is, they're out there. They know. They know all this stuff. That's why we put it out there for them to comment on it. And so Go Away Gray actually has some validity to it. 3 out of 4 people ain't bad. Okay, a minute or two to go here. Yeah, just finishing up talking about this disorder of peripheral neuropathy. There is now objective evidence through research that this is get a load of this, a reversible condition. And we're going to be working on that premise, and we're going to start our discussion on Monday with Dr. Alan Jacobs, a podiatric physician, and as a podiatrist, if there's one thing that you'd have to say the podiatrist sees more than any other single physician, it is complaints and infirmities of the distal extremities, namely the foot. And so as I was talking to him yesterday on the phone, it's no wonder that a podiatrist would be seeing case after case after case of peripheral neuropathy over these many years of practice. He is the author of a paper that we'll be mentioning on Monday. I got a copy of it in my hand right now. The management of diabetic, here it is, the management of diabetic small fiber neuropathy with combination L-methylfolate, methylcobalamin, and pyridoxal 5-phosphate. That's B6, folks. Anyway, this is just a nutritional side of things. As this moves on, you're going to find out that with each prong of attack, you enhance, you double, you triple, you quadruple your ability to reverse this disease and have objective, I said objective evidence that you have done so. Not just subjective, which is good enough, by the way. I mean, if you had no sensation in your feet and now you do, well, you really don't care about objectivity. Trouble is, difficult in the scientific world to promote anything without objectivity, and it comes in the form of something called it's a epidermal skin epidermal biopsy, where you actually can visualize the presence of it's called nerve fiber density, and it's actually measurable. It's actually visualizable, and we're going to be talking about that on Monday with Dr. Alan Jacobs. He's the first in a long line of folks that I'm going to hope to be able to get to before this year is out, because we're launching that program. If you have a peripheral neuropathy, if you are a diabetic, if you know a diabetic, you're going to want to have them start to dial up and listen to the show with us as we begin to launch and begin to offer a program in the up-and-coming year, 2012, entitled Reverse Peripheral Neuropathy Now. I'll let it go with that. Okay. Look, folks, I hope we have a wonderful weekend coming up. I don't know how many shopping days are left, but get out there and use them. Going to be a chilly one this weekend. Nonetheless, we're going to be warming up again. We return with one another on Monday. And the week will go on quite nicely. I'll have some additional guests to bring to your attention, I hope, by Monday. We've got bongos in the background signaling our time out of here at this moment. So this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to